I'm going to follow my general principle and safety practices. I have my band on my baby and the band on the mom for identification. The baby's in a position to facilitate drainage, so they have the head lower than the rest of their body and their head is turned. I'm going to get my bulb. I'm going to stimulate crying, and in the mouth and then in the nose. I'm going to dry my baby and put my baby in a warmer. I'm going to do Apgar at 1 minute and 5 minutes. So I'm going to listen to the apical heart rate. Listen, look at their respiratory effort, their reflex irritability, muscle tone, and skin color. And then I'm going to get their vital signs. So I'm going to get their blood pressure, so make sure I have the proprioceptive cuff. I'm going to get an axillary temperature, and I'm going to check their brachial, femoral pulses. I'm going to look at their umbilical cords. I have a clamp on here. And we make sure there's 2 arteries, 1 vein. We watch for bleeding. We don't want there to be any bleeding or any other abnormalities. I'm going to look at the reflexes of the baby. So the Babinski, I'm going to stroke the foot. I'm going to startle the baby, and I'm going to check the grasping reflex, brooding reflex, and sucking reflex. I'm also going to lift the baby up and see if the head lags when I lay down, and then we'll do the stepping reflex. And then at 5 minutes, I would do Apgar again. I'm going to do a head-to-toe assessment. So I'm going to look for molding of the head, look for lanugo, vernix, any abnormalities at the extremities or with the collar. I'm going to look at the eyes, the nose, the mouth, the ears. I'm going to set the baby up and check the fontanelles to make sure that they're flat, not indented or bulging. I'm going to measure the baby from the head to the heel, top of the head to the heel. And then I'm going to measure around the head, above the pinna, around the eyebrows. And then I'm going to measure the chest. The nipple line. When I weigh the baby, I'm gonna make sure the baby is not clothed or anything. I'm gonna hold a hand over the baby so the baby is safe. I have my cotton paws, so I'm gonna clean from inner to outer. Inner to outer. Then I have my eye ointment. I'm gonna put this in the conjunctival sac. And then vitamin K is needed. I'm gonna clean the leg, get the vitamin K. I'm gonna put my diaper on the baby. And I'm gonna be looking at the hips while I'm doing this. See if there's any issues with the hips. So once I put my diaper on my baby, I'm gonna swaddle my baby and